Yes, viewers and the listeners, you are welcome in our English talk show. And today here, you are with me, Mujahid Rashid, but I have guests whom I'll give them chance as soon as possible to introduce to you. But we welcome you to talk with us and also to listen what my doctors have come here to do, especially with you, my viewer. We are going to talk about heart attack, and these are specialized on that. So we are going to know more from them, and we also expect to benefit also from them. Directly, I will start with my left side, whereby I meet with my doctor here. I'll give him a chance to introduce to you as well as to greet you also. And directly, the doctor is going to tell us when we talking about heart attack, what do we mean about it? Doctor, you're welcome.
Thank you very much. Assalamu alaikum. My name is Dr. Sherin Kassamali. I'm an emergency physician by profession and the head of Accident and Emergency Department at Aga Khan Hospital, Dar es Salaam.
Yes, thank you very much, Dr. Sherin. As I've spoken to the audience or our viewers that today we are going to talk about heart attack, and this is a very major problem which is happening right now with the different people. So sometimes we don't know about when we're talking about heart attack. Maybe you can explain us what is heart attack.
Yes, very sure. So heart attack simply means when there is a blockage in the arteries that supply the heart. What do we mean and why is this important? So arteries supply the heart and they supply blood which is rich in oxygen. Okay. Our body needs oxygen to function. So when there's a blockage to that artery that supplies the heart, from that time the clock starts ticking. Why? It means that the cells or the organ is not getting oxygen at that point. Okay. So that's why it's important to know, and that's why this is a true medical emergency. Because as time goes, without oxygen, that organ starts to die, or the cells start to die.
Okay. Thank you very much, Dr. Sherin. But let's say that some people, or for example, those people in rural areas, in the villages, in the remote areas, they cannot even recognize themselves that maybe I have this problem or I don't have. So how one can recognize that he is affected with a heart attack?
Yeah, so thank you for the question. There's two aspects to it. One is by symptoms that may present with. So for example, if you're at home, you have a colleague, there's classical symptoms and there's atypical symptoms. So classical symptoms would present somebody with typical central chest pain, for example, tightness, discomfort that's there, and that pain may radiate or spread through the arm, for example, to the neck, to the jaw as well. And they have associated symptoms as well. Some of them is they may feel lightheaded because the heart is affected. It's not pumping blood to the brain, so they might feel a little lightheaded or dizzy. And then they may have shortness of breath, difficulty breathing at that time. They may start sweating a lot. Some people, when you look at them, their color may change as well because the major organ is affected. Okay? So these are typical symptoms that may occur. They may feel like they want to vomit or throw up. They may even throw up. In severe symptoms, somebody may suddenly fall down and collapse as well. So that could also be one of the symptoms. Now, when they collapse like that, they may regain consciousness, or they may wake up again, or they may not, because a major organ is affected.
Okay, thank you very much. Doctor, we have heart attack and we have cardiac. Now, is there any difference between these two, or they are similar, same thing maybe?
So a lot of people confuse these two, right? And they interchange the two.
Really?
A heart attack we just talked about, there is lack of blood flow, of oxygenated blood flow to the heart. So it interferes with the function of pumping of the heart, okay? And remember we said oxygen is life. So when you interfere with pumping of the heart, then there's no blood flow to the rest of the body. So heart attack is major that. There's
Yes.
injury to the heart. But a cardiac arrest simply means, cardiac means heart and arrest means stop. That means the heart has stopped. And when we say heart has stopped, a major organ has stopped pumping blood. In other words, we may say that that person has died because there's no circulation of blood at any point.
Really.
So a heart attack and a major heart attack can lead to cardiac arrest. And that's the main difference.
All right. Yes, viewers and the listeners of this program, that is Dr. Sherin Kassamali, who is explaining us about the heart attack. But doctor, sometimes, maybe especially when we are in groups in a different areas, maybe we are drinking coffee, we call in areas where people can just have a little bit chatting. Sometimes they tell you that don't eat food with much fat, don't eat this much, don't eat. Basically, they are talking not as a specialists, no. They only say like that. They think that maybe eating fat is one among the causes of the heart attack. But I think so today is the perfect and exactly time for us to know the causes of heart attack.
Okay, so there's two things there. Okay, when we talk about the causes, what actually causes a heart attack, and there's associated risk
Oh
factors.
yeah, really, yes.
Okay, so let me just start with the risk factors. Risk factors of having a cardiac arrest is, and it depends on ethnicity. The Asian community have a higher risk compared to the others. The age group as well, 40 and above are at risk. However, my youngest patient I've seen with a heart attack that I've treated was 32 years old, and he was male. So male patient you normally present with the classical symptoms we talked about. But other risk factors may include diseases as well, like high blood pressure if it's not controlled, like cholesterol levels if it's not controlled. And cholesterol, there's good fat and bad fat. So if you're having more bad fat, like for example nundu, when you're eating as you're saying, that is not good fat.
And people like it much.
Yes, exactly, yeah. So those can lead actually diabetes, uncontrolled diabetes. That can cause higher risk for getting a heart attack. Now, without forgetting as well, patients, for example, who have central obesity, Vitambi, as well, they are also at risk of getting heart attack. And we say sedentary lifestyle, people who are not exercising, okay, with all these risk factors, they're also at risk. And smoking is also associated. So smoking or tobacco use, shisha, people that use are also associated with high risk for heart attacks as well.
Okay.
Dr. Javed, you want to add anything on,
Maybe on that? Yes, and although I'll give you also a chance, because I have to give also a chance, doctor, to introduce, so that people can know him. So, doctor, you can greet my viewers and introduce, then maybe something to add from this before you get your own question. Yes.
Thank you so much for this opportunity, and let's discuss about all these things. First of all, I would like to introduce myself, that I am Dr. Javed Ahmed Jalbani. I am an interventional cardiologist from Pakistan. Right now I am working at Aga Khan Hospital here in Dar es Salaam. So let's go to the risk factors, very well explained by Dr. Sherin.
Yes.
So she explained all the things related, the major risk factors, like advancing age, male gender, smoking, hypertension, cholesterol. These are the major risk factors. Other than like lifestyle habits, sedentary lifestyle, eating more, utilizing less. There's one of the hidden thing. Nowadays we consume unhealthy diet with high carbohydrates, very less amount of fruits or vegetables. There is a big risk factor. Ethnicity, genetics, family history, they also contribute to that. But we divide the risk factors into modifiable and non-modifiable. Like age and gender we cannot modify, but we can change the habits. We can ask for smoking cessation, so it's a modifiable risk factor. Diabetes is a treatable, hypertension is a controllable disorder. So all those factors that can be modified they are modified, and the ones that we cannot modify, we have to live with them. But we have to improve our lifestyle changes. That's what the risk factors they contribute in leading to the major cause of heart attack, that is called coronary artery disease or blockages due to a cholesterol.
Okay. Thank you. Yes, something to add?
Yes,
Good.
please. So that being said, I only talked about men as a risk factor, but that does not mean that women don't get heart attacks. So we also have women that get heart attacks, but typically women or elderly men or patients who have diabetes may present with atypical symptoms. So we talked about classical symptoms before, but we need to understand there are atypical symptoms that may also present with. And things like we say epigastric pain or bloating is very common in women and patients who are diabetic. Or I've also had patients who are men come in with full-blown heart attacks with no chest pain at all, no pain at all. So diabetes may throw us a little bit astray with not the classical symptoms.
Doctor, to you, we know that there are other some disease, maybe one can be affected due to the age. Maybe he's old, 70s to 80s.
Yes.
They will tell you that, oh no, this is because your age is gone. That's why you are getting this kind of problem. What about in heart attack? This will also depend on the age, or in any age one can get this problem.
Though heart attack can occur in any age, but age is the major risk factor. Major non-modifiable risk factors. Some ethnicity or some people in the world have heart attack at earlier age, like Asians have earlier age of heart attack occurrence. Many of the world nations, they have heart attack in later their life, usually after the 50s. So age is major determinant. Some people are healthy, they don't have heart attack at the age of 90 or 100 years. So it depends upon the lifestyle also. So age is a major risk that is contributing.
Yes, doctor, when you're talking about lifestyle, I think so we have two people. We have those people who live in town, and we have those people who live in the village. And they quite use different things. For example, people from the village, they eat much natural things. We people in town, we eat much those factorized maybe food. So whom are in high risk maybe to have this problem between this kind of people from rural or?
That's very easy and simple. Even living in the town, living in the village, it's the habits, that decide our nature of living. If someone living in the city, major city, has a habit of walking, losing weight, or maintaining weight, taking a healthy diet, doesn't matter wherever. Although we know the environmental factors do contribute, but that is a very less contributor. But in the villages, it is a provision or non-provision. Villagers don't have provision of the transport system, they walk a lot. That means they do the exercise. They have, by nature they have some, they have provision of vegetables, they have provision of fruits, they utilize more, the natural things, and they are away from the polluted environment. So pollution that do affect the living standards. So actually it's the provision and non-provision, and someone's commitment to their lifestyle. Most of the people living in the cities, major cities, they have a problem of transportation, busy roads, they don't get time for themselves, they have to take a lot of time in their work, job, then they have a lot of traffic issues, they utilize their time over the traffic issues. When they reach home, they are tired, they don't have will to go for their exercise, or they cannot even, they hurry for the easy made foods, their junk foods, they contain a lot of unhealthy portion of the diet. So it's natural, they will have that problem later in their life.
Really, exactly. I think so. We needed to also we have to do an exercise, not eating and sleeping much. This it is a problem. Now we want to know now. Okay, what should we do, or what should when someone is experiencing maybe symptoms or the heart attack? For example, if I have this problem, right? now, or I have these symptoms. What should I do for my primary maybe, or what should I do for that actually?
Okay, thank you. Also, just go back to your previous
right.
question I
Yes.
not completed. That what exactly causes this heart attack?
Really, yes.
Yeah, it's actually the buildup of cholesterol in the blood vessel. So over time, when there's buildup, there's decrease in the lumen, or we say the diameter of blood flowing,
Okay.
right? So that may cause reduced blood flow, but that can cause something that is a plaque formation, and that may break off, and it causes a clot. So that can go and block the artery and cause a heart attack.
Yeah.
So if you're experiencing the symptoms that we talked about, it's very important to go and seek medical care early. Because you need to come to either a hospital where they can diagnose it, okay? So like our hospital at Aga Khan, we have an emergency department, and we say heart attack in medical language, we say myocardial infarction. We are myocardial infarction ready.
Really?
Okay? So when somebody comes in with this symptom suspected, they are prioritized first of all. And when they are prioritized, we listen to you from the history, we assess the risk factors, we check in your vital signs, mainly we want to know your blood pressure at that point, we need to know your oxygenation at that point, we look at your heart rate, and very importantly, the initial thing that we do is we get an ECG. That ECG is what's going to tell us that this is a true complete blockage of a vessel, where now we start following our American heart guidelines, where time is actually muscle, we say. The longer you wait, the higher the risk of either getting a cardiac arrest or causing damage to the heart, either temporary or permanently, okay, which we call as heart failure. So once that happens, if we recognize from the ECG, from the strip or rhythm, that this is a full-blown heart attack, then we activate, we say cath lab, and we activate our interventional cardiologists.
Really?
So we share that with them immediately, and this is supposed to be done within 10 minutes of arrival. Because as soon as we identify that it's a true medical emergency, and then we take consent from the patient, then they need to go for a procedure with my colleague will speak about shortly.
Yeah. Really.
Yeah, and that target from arrival to the intervention needs to be 90 minutes. So it's time.
All right. Doctor, I'll come to you.
Sure.
Sometimes we have, we are infected with the various disease, and sometimes those diseases do not appear early. What about to the attack? Direct when you are attacked, you will recognize, or it can take you time or for some times to recognize that you have this problem. And what about if you don't recognize for a long time? What is the exactly time that if you want to recognize during this time, maybe your problem will be very big, or the duration of the problem?
That would be the main talk of the this
Yes,
day,
this
because having a heart attack and treating later on, definitely there's little damage that we cannot reverse. So before happening of the heart attack, everyone should know what is their status,
Really?
so that they can prevent at least. And they should prevent what is going on inside silently. So what we see in our general population, people don't have a behavior of a routine checkup, or even if not going for a routine checkup, they should have an awareness themselves. Heart can accommodate 10 times of their natural normal resting condition. So when heart is working at this resting condition, it has natural capacity to accommodate a stress about 10 times higher than the resting condition. So when we want to see the heart, we have to bring the same simulation. When we do exercise, that tells us how our heart is working right now. If someone cannot meet that healthy criteria, that means there is something going on, that heart is not able to. Usually people do have their blockages in their coronary arteries, that is mild progression to moderate over many years. Now after many years, that will get into a worse situation. Then it's a severe, one day that cholesterol plaque that is built up in the vessels, that will burst. and will cause a major heart attack immediately. So what we see the fitness of the body, we see the fitness of the heart, how one can work. The best simulation is walking, then running. There is a treadmill test that we test a lot of people. So 3 minutes, 6 minutes, 9 minutes, people run with different stages, with different capacity. We calculate in metabolic equivalents. That's actually simulation of a stress to the heart. It's a normal physiological stress, that means it's not harmful, but it will give us a clue that there is something going on inside the heart, and heart is not able to cope up this much stress. Usually we see a lot of older age patients, they get an infection, and that infection gets more worse because heart cannot compensate, because it's already affected. So we need to know prior to all these happenings. There's a routine checkup. Everyone should go for a yearly checkup if someone is not having any disease, and to know what is their status. So we can check by different modalities, different investigations. The best one, someone not going to the hospital, is walking, going uphill or running. When someone cannot run, he or she must know that there's something going on, we should visit a doctor.
Really?
That can give us a clue.
Exactly. What doctor said actually is correct, that we have to prevent ourselves in this. We have to keep on maybe checking several times. But most of people do fear. They fear. They say, if I go there and then I'll be caught with this problem, then I start living like this. You see, like so many people fail either to go and check maybe with HIV/AIDS. They say that once I'll be caught, then my life will be like, no, I want to enjoy, or I will stay like this. So even to this, maybe how do you experience people come much to check this heart attack?
So I can answer your question in a couple of ways, but mainly diseases like HIV are what we call communicable diseases.
Not really, really.
Okay? Risk factors for cardiac disease or heart disease, majority of them are non-communicable diseases.
Really.
Okay? That's why we said the risk factors fall into two main categories. One is modifiable and one is non-modifiable.
Yes.
Non-modifiable are things like, as we spoke about, the age. I'm born a woman, I'm not a male. So those already are risk factors as well. But the modifiable ones, which include lifestyle, which include identifying diseases early, which we can control, which includes high blood pressure, for example, which includes the high cholesterol levels, for example, which includes diabetes. And to your question, it's prevention is better than cure.
Really?
Okay? Because if you can prevent it from happening, then maybe your life can be prolonged and you may not suffer the consequences or the effects of not treating it.
Yes.
Without treating it, sometimes you may come in very late. And when you come in very late, you can have, the outcomes could be that you have a heart failure from it. You may, because you can't change what's already happened if you presented late, and even death can happen. Okay, and it can happen in young people as well. So that's very important to understand. Another thing that we should understand as well, that this issue or this buildup of cholesterol in the blood vessels is a spectrum of disease. A major heart attack is a final at the end. Okay, so this buildup, as Dr. Javed correctly said, it can take a long time and can take a while. That's why checking or going for checkups is very important. So we can find out the function of the heart. So normally our heart is dynamic. It responds to our function, our demand. If we are running, for example, our heart starts pumping faster so that we can keep up with the blood supply and oxygenation to our body rather than when we are resting. So that's what Dr. Javed was talking about, that when we are checking, because one thing is getting an ECG, right? The other thing is looking at your risk factors and trying to control them. But the vessel life and how the blood supply is coming to the heart, that is something they can check as well by your exercise tolerance. So by seeing that if you're able to walk there your heart can accommodate that demand.
Really?
If you increase that demand a little bit when you're running, are they getting symptoms because of that reduced blood flow or supply to the heart? That can also be a factor.
Okay, thank you very much. I will come to Dr. Jalbani, but starting from Dr. Sherin. Now let's discuss about the immediate treatment options for the person who is already affected with a heart attack.
Okay, so
Yes.
one of the things, there's medical treatment and then there's intervention,
Really?
right? So as we said, when you come in with these symptoms, we identify you, we prioritize you, identify you by asking questions, getting your vital signs and getting initial ECG. After we do that, if we've identified that this is a heart attack, we've activated and informed our cardiologist, one of the medications that we need to treat or give is aspirin. Aspirin has actually been shown to reduce mortality in heart attacks. It's been studied in different ethnicity to say that this reduces, because what causes a heart attack is that clot that goes and blocks. Aspirin is a clot, it's an antiplatelet, so it tries to not exacerbate or to make that condition worse at that point. That's why it is shown to reduce death when given. So that's one of the treatment that's given. And you can also treat the other things, like if they've come in with shortness of breath at that point, they're not unable to breathe very well because their demand has increased and their heart is not functioning very well, we can support them with oxygen. If they're in severe pain, we can treat the pain. From there, then there's other medications which I'll ask Dr. Javed to speak about, and continuation of once we activate the cath lab, what do we need to do? My colleague will speak about that.
Really?
Yeah.
Thank you very much. Doctor, you want to ask
I will
something?
definitely.
Yes, before we go to understand, to know more about angiography.
Yeah.
Yes.
So when anyone with the heart attack comes to the emergency, is always treated first by the emergency crew.
Okay.
They know all the settings, what to do. Then they call us for further procedure. The best drug that we have till today seen is aspirin, as Dr. Sherin mentioned. This has reduced death rate when given as early as possible. The first medicine that we prefer everyone to take with a medical opinion or medical advice would be the aspirin. We call it aspirin. It comes with different names, but baby aspirin is 75 milligram is less dose. That 300 milligram tablets are the best and dispersible. Once someone chews it or takes it by mouth, within 5 minutes its concentration increases to rise in the blood, and this will inhibit that clot formation, so it will not progress. The human machine or any natural body is equipped with all the natural processes. We believe on all those preventive mechanisms going inside our body. When we give these blood thinners to any patient, new clot formation stops, and the previously little bit formed clot starts to dissolve by itself by natural protective mechanisms. This helps a lot. Then there are other additional antiplatelets called blood thinners that we load the patient before going for angiography and angioplasty. So there are two modalities for acute heart attack treatment. One is an injection that we give to the patients if there is no facility of cath lab or there is no facility of angiography or angioplasty, then that blood clot removal drug is there. So throughout the world we find different drugs, but every country has one or two of those. So if there is no facility of cath lab, that blood clot removal drugs are there, but they have some danger of bleeding. Best method is doing angiography and angioplasty in due time. So once the cath lab is activated, we make sure that patient's time is not wasted, because time is muscle, time is money, and that time actually saves the complications of the heart, and that's what all the aim is to do. So we take immediately that patient for cath lab. Cath lab is a just like an operation theatre is a room equipped with a machine where we minimally invasive procedure do, that's through a cannula. Nowadays we do from the hand. There are two major vessels in the body that go to the heart easily, that give us an access to treat the heart attack. One is at the hand, one is at the groin. So nowadays we use the way that is going from the hand to the heart. So we pass catheters up to the heart, and then we take the wires and all the gadgets inside. We first visualize, give a medicine that visualizes where is the blockage, where is the clot, which artery got a heart attack, and then we remove the clot first. And then we see if there is any chance to place a stent, then we place a stent to open that blockage caused by cholesterol. So clot that we remove, or it is dissolved by our medicines.
Yes.
Then remaining cholesterol causing that blockage, we remove it by placing a stent. A stent is a material we call as a steel material, an artificial thing that opens up the blockage. If there is any severe blockage, when we open it with a balloon, it gives a way to blood to flow further and nourish the heart, deliver the oxygen and other nutrients. So if we count the time more than 90 minutes, the heart muscle recovery is less. After 3 years, there is little benefit of recovery. Within 3 years, most of the heart muscle dies. So we have to prioritize that our procedure completes before that precious time to save the heart muscle, to save the patient from complications, from disability. Okay, so that's why angiography and angioplasty is the best treatment till today, the advances that we have.
All right. Thank you very much. Maybe Dr. Sherin, something to add?
I explained very well.
Yes.
It's just an analogy.
Yeah, really.
You can use, when a pipe is blocked, what do? You go and unblock it so water can flow.
Okay. Yeah, really.
Sudhivya.
Yes.
Exactly. So that's the same with the blood vessel in the heart. If there's a blockage, you need to remove that blockage.
Yes, so that to leave the, to let the flowing of the blood.
Exactly, yeah. So that the muscle can be, the oxygen-rich blood can reach the heart and can continue providing, to prevent death of the muscle.
Yes. Doctors, maybe let's take an opportunity to advise our viewers, right? Doctor has spoken much about lifestyle. Yes, this is very important to advise also our viewers on how directly to prevent from this, because prevention is better than cure. We know that. Nobody wants to get this problem. Now, sometimes you can get automatically this problem.
That's related to the heart attack symptoms also.
And that's
we call pain is a blessing. Pain is a blessing. All those people who don't experience much pain, they miss the heart attack. They come late with the heart failure symptoms. They never say we had a heart attack because they don't experience pain. So though we know pain is a difficulty for us, but God has given us an alarming system. Whenever there is something wrong going in our body, either we will have pain or fever, uneasiness. These are alarms. When they ring, we must take care of this, and we should respect the natural alarms. So pain, that's the pain that brings the patient to the hospital. They don't know what is a heart attack, but they know the discomfort they do have.
Right. Yes, I was with you, Dr. Sherin. Before I give also a chance to Dr. Javed, to explain people, or to tell people how could they prevent from this, at least the primary knowledge.
Okay. So Dr. Javed has already explained a lot about lifestyle changes. So I will focus on one that, all these modifiable things, like if you are having, a lot of patients we see with diseases come to us and they're not on their regular medication. So you need to control these risk factors. So these risk factors like hypertension, and let me just speak a little bit about hypertension. Hypertension, a lot of people are walking around with hypertension, and we call it a silent killer because they don't know if they don't check. So you need to check first regularly to identify it early. And once it's identified, you need to control it. So being on your regular medication is very important. So controlling your blood pressure, controlling your blood sugars and your diabetes is very important as well. So other lifestyle changes apart from food and exercise includes, like, cessation of smoking, for example, because that is linked as well for high risk factor for an arrest. And because I'm an emergency physician, I want to emphasize that whenever you have these symptoms of alarming symptoms of chest pain, do not ignore it. or do not go late to the hospital. You need to identify that and go to a hospital nearby that can identify that this is a heart attack and do something about it. If you go to a hospital, for example, you don't have the classical symptom, you come in with epigastric pain, bloatingness.
Yeah.
They may just treat it as AG gastroenteritis and then send you home. An ECG is not done and you miss a heart attack.
Really?
So you may come or present late. So we have some group of patients that come to us with a missed early diagnosis where something could have been done as well. So that's why I would emphasize to come early to a hospital facility that can identify this is a heart attack and can treat it within time.
If I quote Dr. Javed, said that we keep on making a checking up. We check up, but now how often should I check about this? Maybe once a year or once a month, or how often should I check myself?
So actually that question is a very good question for my colleague Dr. Javed.
Okay.
For me is when you come in an emergency, I will treat you directly.
Yes, doctor. You told us that we have to keep on checking, right?
Yeah.
Yes. Now, how often should be this checking?
That depends the risk factors.
Okay.
Anyone having risk factors, like someone who is already a hypertensive patient, diabetic patient, they come to the hospital because of these two reasons. So they have often visits to the hospital for their medicine follow. For those who don't have any risk factors, they don't know. There are a lot of people walking around, they don't know they have diabetes.
Yeah, really, yes.
So it's necessary, especially in Asian communities, we prefer that they should come after 30 years of age. They should come for routine visits every year to check for their sugar, for blood pressure, for related other risk factors like if they have obesity, hypercholesterolemia, high cholesterol, or they have other diseases. They don't know, the symptoms are vague, but they have young females having hypothyroidism, they don't know. There are a lot of people around in the city, they don't know. That's what we know through the physical examination. So most common major risk factors they should rule out every year, like check the blood pressure, check the sugar, check the cholesterol. These three are very easy. Right away over the OPD, everybody is checked for the weight and height, they check the BMI. So we know from that someone is obese, is overweight. So we have to differentiate that. Obesity is a risk factor. If we come to know that patient is obese, we can recommend them to lose weight by diet and exercise. So for reducing the risk, reducing these bad diseases, we need to check every year, especially after 30 years in Asians. The rest of the more than 40 years, they should get checked. There's a healthy activity.
Oh, really?
Once in a year, I don't think so, it's a big deal.
Yeah, no, it's okay. It's good. It's okay. But sometimes, doctor, the other people, according to their lifestyle, their work style, maybe they don't move much. They go to the office, they stay maybe 12 hours or 8 to 10 hours. From there, direct to the car, sitting. Home, sleeping. What about this?
There are a lot of people. Their offices are at first floor, they will use elevator.
Okay, yeah. Really, yes.
So
they cannot climb the stairs.
They won't use because they are tired, they are fed up.
Okay.
These actually are the behaviors in the personality. We call different personality behaviors.
Really, yes.
Some people are committed to their mission, some are not. Some are health conscious, some are not. So personality A type of behaviors do have these things. They prioritize their work, their busy schedule, not even the work. They do not prioritize their health. They are target oriented. They have more heart conditions or heart attacks. They die more of heart attacks. So this depends upon the psychology. Some people are having depression. They don't know. They are not aware of that. Some are facing anxiety issues. They don't know. So health consciousness is something in the personality. Very active, very healthy psychologically people, they decide for themselves, for their work, for their health, for everything. So it depends upon the lifestyle and behavior and psychology and habits, depression, all these things.
All right.
Some people committed, they even go up to 5th floor with their stairs.
Yeah.
They don't have time, but they use this time for their physique.
Oh, yes, yes, yes.
While going to the car, they will take a long turn.
Mm-hmm.
For their prayers or any
Really?
religious activities, they will find out the walking distances. This way they engage themselves for the work. Even during the work, people should use every 30 minutes to 1 hour, they should take time 1 to 2 minutes,
Yes.
walk around and come back.
Really?
That's very easy.
Exactly. Thank you. Dr. Sherin, we are almost to end up our program, but I hope you will have something either to tell your viewers who are looking and listening to you now.
So actually, the first time I saw this 32 and 35-year-old male patient who came in with a heart attack, you know,
Okay.
one of them actually got a cardiac arrest in front of me. So they were trying to die in front of me, which we resuscitated. And our interventional cardiologists were able to remove the blockage in time. And because oxygenation continued, there was no stoppage for too long, the person survived. But I went home that day and I told my husband, we need to change. We can't be so stressed all the time. We need to start with us. And for us, we need to make sure we're eating healthy and we need to make sure at least half an hour we are walking.
Really?
So we really try to put that in our schedule and it starts with us. Only with
Okay,
us.
and
So,
that is what we have to do.
yes.
Right.
First understand the risk and then it starts with you. If you want to live healthy and long, then definitely you need to work towards that,
Really?
right?
Yes.
Otherwise you may suffer later on. The consequences.
Thank you very much, Dr. Sherin.
Thank you very
Yes,
much.
Dr. Javed, what you want to leave with your viewers?
Yeah, I have the same message.
Yes.
Love their life
Really?
and love their heart. So this is like time is money.
Really?
Someone dying at the age of 40 and someone dying at the age of 90 with a healthy lifestyle. See the difference of time. Someone who is having education, peak of their experience and either dying or having a disability because of the disease. They cannot perform well.
Really?
So someone who is healthy and active till the 90 years, how much time they gain to work for their finances, for their worth and for their wealth. So health is time,
Really?
health is money.
And
So
that
either it's long term or it's an acute emergency. Time and health both are together and that actually decide your finances.
Really. Thank you very much,
Thank you.
Doctor, and thank you very much also, Doctor.
Thank you.
Actually, I have many things to know from you, but also our time is gone. I hope, inshallah, next time you will join us
Sure.
for more. But finally, before I close, I end up with my session, Dr. Sherin. Do you think, for example, someone is affected or someone is in the village, now Dar es Salaam is far from there, how you people try to help these people from the remote area?
That's a challenge. That's a challenge of that I may not be able to answer here. But what I can say or suggest is they need to be aware that this
Really?
is there. Okay, they need to be aware of their health. They need to be aware of these risk factors that they can be there,
Right.
and continue to live a healthy lifestyle as best as possible to prevent things like heart attacks.
I thought you will tell me that, okay, we shall think or we'll think how to keep a camp over there, maybe all over that areas.
So maybe that's something that we can look at,
Yes.
because there are regular camps that happen in terms of our outreach centers and at the hospital. And the things that Dr. Javed was talking
Yes.
about, the camps include looking at these risk factors, but they can also calculate a risk of when you can or when you may develop at this time develop a heart attack, for example. It calculates within the 10 years you have this percentage of getting a heart attack if you do nothing now. So if you modify, you may reduce that risk.
Okay, thank you very much. Dr. Javed, thank you very much for joining me, as well as Dr. Sherin. Thank you very much
very
also.
much.
And you are welcome again in our studio.
Thank you.
Thank you.
Very much.
Yes, viewers and listeners of our program, here at the end of our program, it was me, Mujahid Rashid, together with my doctors. Thank you and have a good day also. Thank you very much.
Thank
Right.
you.